approached by concerned citizens and have been asked to speak to the Minister of Health. I am Emperor Elijah, and the concerns voiced regard the numerous deaths at certain hospitals, and we're being asked to have some kind of an audit done. We need some numbers as to how many operations. I want to see what happens just with the female surgical wards. How many operations are conducted on a daily basis since the year started? How many of them were successful? How many deaths occurred since the year started? And we love to do an analysis of the numbers, the data from Cornwall Regional. We'd like one from the Falmouth Hospital, one from the St. Anne's Bay Hospital, and Anata Bay Hospital. We love to see the correlation between the successes. So we're seeking to know how many operations are done on a daily basis since the month of January to this point, and the nature of the operations, and we like a breakdown. We want to know if student practitioners are actually experimenting or practicing on patients. If the patient concerned is of a certain stature, would such a doctor be permitted to do an operation on that individual, or would they seek someone more seasoned, someone with far more experience, with more success rates? And we'd like to know if that is the case, where there are special doctors for certain individuals. Why is this the case if that persists? We've observed numerous deaths, and it is of grave concern, and we're calling on the authorities to give us answers. In the anthem it says TRFA, true respect for all. Every member of this nation must be treated equally in terms of respect. There's none above the other. And if health has become a business where those who are responsible for the safety and the health of our people can charge exorbitant prices, price it out of the reach of the ordinary individual, and compelling them to accept substandard treatment, that will be a crime and must be addressed. And the people of this nation are demanding answers, and we're going to stand up to ensure that we're treated with dignity and respect. No doubt about it. I speak on behalf of every single Jamaican on this nation, within this nation. I personally went to a hospital, and in the emergency room, I witnessed a guest of a particular hotel. She was Oriental. Their husband was standing on the outside and they were curtained off. Whatever abdominal condition she had, she was examined by a doctor and he came out and he said it was inconclusive. Now the hotel nurse was there present. Another doctor came in, examined, came back inconclusive. And I stood there and witnessed 5 different individuals who went in and did their assessment. And on every occasion, the lady in question cried out. And she was being examined. And these interns, who they were at the time, gathered right in our presence. We're joking about it that the other one rushed it too much, must take his time and take your time. You rush it too much. All of them came down to practice. We understand that it requires practice to gain experience. But in my estimation, there should have been a senior doctor to monitor, and the lady's dignity was being trampled upon. And they reached the point where the gentleman, the husband in question, was distraught. You could see he was embarrassed by what was happening because they were violating the woman. And the nurse stood up and she said, "No more, not one of you touch her again." I witnessed that years ago at a particular hospital. I say too, from the head, would the Governor General be there and allowed to be examined or treated by these interns? Would the Prime Minister, would ministers of government, or do you get the best? We the people have given you the best. And the feelings that we're being treated with can't disregard. And it must cease. And the people of this nation demands better. Nothing less. We're calling for answers. We're expecting a response. And I'd like every single member of this nation to be aware of their right to dignity. This is the voice of reason. Emperor Elijah and Franklin J. Wallace.